the importance of cleaning and disinfecting your Pari Reusable Nebulizer. Brought to you by Pari, the trusted brand for respiratory therapy for more than 100 years. Pari Reusable Nebulizers are trusted by pharmaceutical companies in more clinical trials than any other brand. With Pari Nebulizers, patients of all ages are assured the aerosol therapy to help improve their quality of life. Meet Pseudomonas aeruginosa. Pseudomonas and this little band of bacterial misfits can cause lots of trouble for people with respiratory conditions. Today, we're here to talk about keeping your Pari Reusable Nebulizer working properly by cleaning and disinfecting it regularly. To start, disconnect the tubing from the air intake on the bottom of the nebulizer cup. If there's any moisture or condensation in the tubing, let the compressor run with only the tubing attached for 2 to 3 minutes. The warm air from the compressor will dry out the tubing. Disassemble reusable nebulizer parts as illustrated here. Wash all parts with warm water and liquid dish soap. Please do not wash the tubing. Rinse the reusable nebulizer parts thoroughly with warm water and shake to remove excess water. Air dry or hand dry nebulizer parts on a clean, lint-free cloth. Reassemble the nebulizer when parts are dry and store. Your Pari nebulizer is dishwasher safe. Again, please do not wash the tubing. Place the reusable nebulizer parts in a dishwasher basket. Then place the basket on the top rack of the dishwasher. Remove and dry the parts when the dishwasher cycle is complete. The Pari Reusable Nebulizer parts, except tubing and mask, can be disinfected by boiling them in a clean pot of water for a full 5 minutes. Dry parts on a clean, lint-free cloth. It only takes a few extra minutes to keep your Pari Reusable Nebulizer working properly. Remember, clean and disinfect your Pari Nebulizer regularly and optimize disinfection to minimize contamination. These instructions are taken directly from Pari's approved instructions for use. Always consult with a qualified and licensed physician or other medical care provider and follow their advice.